name is Hannah Mattern. I'm going to complete your head-to-toe assessment today. Later in the assessment, I'll ask you to remember my name. So I just washed my hands, and we're going to go ahead and get started. Can you tell me your age?
I'm 20.
Okay, so you're a 20-year-old Caucasian female. Your apparent state of health is healthy and vigorous, just from observing you. Can you go ahead and give me your height and weight?
I'm 5'1" and 140.
Okay, and your BMI is 26. Your dress, grooming, and hygiene all look appropriate for today. Your mental status is cooperative, or your general demeanor, is cooperative. Your affect is animated, thought pattern appears logical from our conversation, and your speech is articulate. Your level of consciousness is alert. And now I'm going to test your orientation. Can you give me your full name?
Alexis Marie Johnston.
And where are we?
Steubenville.
And what is the day of the week?
Today is Friday.
Okay, so you are alert and oriented ×3. And then to test your remote memory, can you tell me who the president was before Trump?
Obama.
Okay, and a recent memory is my name?
Hannah Mattern.
Okay, and now for abstract thinking, if I were to tell you an apple a day keeps the doctor away, how would you interpret that?
Like if you eat healthier, then less you have to go to the doctor, less problems.
And for judgment, if you're preparing to go out in the rain, how would you dress?
I would have a raincoat, umbrella, boots.
Okay, so all intellectual capacity is intact. Now I'm going to go ahead and take your vital signs, starting with your temperature. Alright, your temperature is 97.9. Next, I'm going to do your pulse. Alright, your pulse was 62 and respirations were 18. Now I'm going to go ahead and do your blood pressure. Oh gosh, sorry. Thank you. Alright, and for your final vital sign, are you having any pain today?
Nope.
Alright, next I'm going to go ahead and examine your head, starting with the shape. Looks normocephalic, symmetrical. Your hair is blonde. I'm going to feel for any lesions, bumps. No, looks good. Everything looks appropriate. Now your eyes look properly aligned with your ears. The prominence is intersecting at the appropriate level. Now let's go ahead and do Perla. Alright, I'm going to have you look at the bridge of my nose while I shine the light. Okay. Alright, Perla was good, positive, accommodation. So I'm going to have you start by looking at the wall behind me and then coming to the tip of the pen light. Go ahead. All right, and accommodation was good as well. So the EMOs, I'm gonna have you watch my finger and follow it with just your eyes only. Good. That indicates that the cranial nerves 3, 4, and 6 are intact by the 6 cardinal fields of gaze test. Now we're going to go ahead and do your ears. Your ears again look symmetrical. I don't see any lumps or lesions noted. Again, there's no redness or discharge noted. Okay. Are you having problems hearing today?
Nope.
Okay, gross hearing is intact. Next, we'll do your nose again. All right, any congestion?
Nope.
Drainage? None noted. Are you having any difficulty breathing?
No.
Okay, any problems smelling?
Nope.
All right, so breathing and smelling were both grossly intact. And now your throat. Look into your mouth with my light again. All right, looks good. Red, moist, everything's intact. No lesions were noted. No missing teeth. Are you having any problems with your teeth? Chewing. No dentures. No odors. Can I go ahead and have you swallow? Okay, swallow was positive. And then for tracheal alignment, I'm going to palpate down your trachea. Okay, good. And down to your sternal notch again. Okay, everything is symmetrical and in line. All right, now I'm going to go ahead and examine your lymph nodes, starting with the pre-articular, and then post-articular, occipital, submental, submandibular, tonsillar, superficial cervical, and deep cervical, posterior cervical, and supraclavicular. All right, so all the lymph nodes were non-palpable. Any tenderness when I did that?
Nope.
All right, now we're gonna go ahead and do the carotid. Can I have you turn your head that way? I'm gonna go through your Adam's apple down 2 fingers. Alright, carotid is present and strong, 3+. Let's check this side. Alright, and both sides are symmetrical. I'm gonna osculate for Bruies. Alright, can I go ahead and have you take a deep breath in and hold it and turn your head that way? Okay, good. Go ahead and breathe. We're going to do the same on this side. Okay, good. So no turbulence and negative for Bruies. All right, next I'm going to check your skin. As I can see, the color looks good. Appropriate flesh tone. Temperature is good. Bilaterally. Okay, moisture is appropriate. Texture was smooth. Turgor, go ahead and pinch an inch. Should snap right back into place. Good, turgor was good. And no visible lesions. Now we're going to go ahead with the heart assessment. So for pulsations, first of all, can I have you go ahead and lay down here, please? Okay, so pulsations are negative. Okay, so now we're going to palpate through, starting at the sternal notch for pulsations and thrills. So the sternal notch over to the second intercostal space. So no pulsations, no thrills. No pulsations, no thrills. Down to Erb's point. No pulsations, no thrills. Fourth intercostal space. No pulsations, no thrills. Fifth intercostal space, which is also the tricuspid. No pulsations, no thrills. Over to the PMI. Okay, I'm feeling a faint, dull tapping, which is normal and appropriate. And no thrills. The rate and the rhythm at the PMI were in line with the vitals. Okay, now I'm going to listen through for the appropriate relationship of S1 and S2. Now to your sternal notch again. Over. Okay, good for the aortic into the pulmonic. Good, Erb's point. Good, fourth intercostal space. Good, tricuspid. And the baby step. And then to the mitral. Good again, there was an appropriate relationship of S1 to S2. The rate was consistent with vitals, the rhythm was regular, strength was strong, and I didn't detect any extra heart sounds. All right, so now we're gonna assess your lungs. You can go ahead and sit up, please. Okay, so your thorax has appropriate size and symmetry. No barrel testing is noted. Okay, no deformities. I'm going to palpate across your clavicle. Good. And down your sternum. Good. Symmetrical. And then can you go ahead and shrug for me? Good. Okay, so everything on the anterior is symmetrical. I'm going to go ahead and test your respiratory excursion now. Could you turn your head to the side and take a deep breath in and out? Good. Okay, so it was deep and symmetrical as well. Check for lesions. Are negative. Good. And then I'm going to osculate. All right, I'll have you breathe deeply through your mouth, but no faster than normal. Good. Everything sounded clear. Rate was consistent with vitals. Rhythm was regular. Depth was deep. Effort was non-labored. And I noted no use of accessory muscles and no adventitious breath sounds. Now for your posterior. Start by palpating your scapula. Can you go ahead and give yourself a hug? Good. Okay, and then down your spine. Good, your spine feels vertical. And your scapula are both symmetrical. Appear to have the appropriate S curvature. Okay, so then your AP transverse diameter is half of the lateral, which is appropriate. Okay, and then again, I'll have you do the respiratory excursions. Go ahead and give yourself, or take a deep breath, I'm sorry. Good. All right, now osculate through one more time if you don't mind giving yourself a big hug, and breathe deeply through your mouth, but no quicker than normal. good. Again, the rate was consistent with vitals. Rhythm was regular. Depth was deep. Effort was non-labored and no use of accessory muscles or adventitious breath sounds. Now we're going to go ahead and assess your abdomen. Can I have you go ahead and lift up your shirt a little bit? Good, that works. I'm going to get eye level and expect. Alright, no distension and no pulsations were noted. I'm going to go ahead and osculate to one quadrant of your stomach for 1 minute to determine the bowel sounds. Listen to your bowel sounds. Alright. Okay, good. I heard 10 gurgles, so normal active bowel sounds. I'm now going to percuss around in a circle. Okay, good. Tiffany was heard all around. I'm now going to palpate, starting lightly and then going deeper. Okay, good. Any tenderness there when I did that?
Nope.
Okay, I didn't palpate any lumps or enlarged organs, so no organ myopathy. The bladder was non-palpable. All right, now you can go ahead and sit up. All right, are you having any joint pain anywhere?
Nope.
Any stiffness?
No.
Okay, everything looks symmetrical, no disformities in the body structure are noted. Range of motion, any difficulty with moving any of your joints, upper or lower?
Nope.
Okay, good. When you're moving those joints, do you notice any crunching or crackling sounds in the joints?
No.
Okay, no crepitus is negative. Extremities, the color appears good in both the upper and lower extremities, and temperature. Good. Temperature is appropriate in both upper and lower. Pulses, I'm going to go ahead and check your pulses bilaterally, starting with your radial. Okay, good. Both are present, symmetrical, 3+, and intact. Your posterior tibialis. Okay, good. Both are 3+ again and symmetrical, and then the dorsalis pedis. Your greater toe tendon. Good, and then again, they're both 3+ and symmetrical. Now I'm going to test your capillary refills, starting with your thumbs. Good, refill was less than 2 seconds. Good, again, very brisk refill. Good. And so brisk capillary refill for the upper extremities and the same in the toes. Good. So brisk capillary refill on both upper and lower extremities. There's no evidence of edema noted. Now for your neurological, I'm going to cross my fingers here, have your piece. Sorry, can you squeeze first, please? Okay, and then push and pull. Okay, good. And go ahead and push with your legs and pull. Okay, so upper and lower extremities are bilaterally strong and intact. Coordination, can I have you walk across the room to check for any gait and coordination? Good. So that was smooth, no ataxia and no imbalance problems. Are you having any sensory problems, hot, cold, numbness, tingling?
No.
Okay, good. And any problems with sensation anywhere?
No.
Good. All right, and then for the deep tendon reflexes. Okay, I'll touch your bicep first. Go ahead and make a muscle, then release. Good. See on this side, make a muscle and release. Good. Both were bilaterally and normal. And then for your patellar, I'm going to go ahead and hit the front of your knee here to test your reflexes. Good. Good. Again, both were bilaterally normal and appropriate. Both were intact. And then for your short-term memory again, can you remember what my name was from the beginning?
Hannah Mattern.
Good. All right. Thank you.